Hello, you are watching the MA Module 3 Clinic training. And in this course, we will be in administration of medication. Many instructors and students look forward to this module. It's a really fun, hands-on module. As a clinic instructor, you will have not just residential or on-ground students in your class, but you will also have hybrid students meeting with you every time you teach. So you will have possibly a very large class. Being organized and having good time management is going to be essential for you for this module. Hopefully you have already watched and have made yourself familiar with the setup of the course shells. So we will skip down to approved Quizlets. There are a few approved Quizlets for the clinic class, which is a bit unusual. We've included the pharmacology abbreviations, prescribed medications, and classifications of medication. If you'd like students to use them on their own, they're more than welcome, or you can use them together, Quizlet live in class. Make sure that you are accessing all of the resources that are available to you. I encourage your students to do so as well. We will be in SimChart and SharePath in this module. SimChart would be a good way for them to document the injections that they give in class. There are also, make sure they're following the syllabi. Here are the row. And then there are clinic ICA available to you as options in case you find that you have some extra time or you find your students need a little bit more practice with a topic that you are covering in class. These can be done as a class and then reviewed, or they can be given out as an extra assignment. We also have Simtex in this module. Simtex is a web-based program for simulation of certain procedures. The procedures that will be simulated here are the intradermal injections, intermuscular injections, and subcutaneous injections. These are not optional. Students will spend time practicing the simulations. They can do these at home, or they can do these in class if they find they have extra time. And then they will be tested on these later in the module. Encourage them to use these as often as possible. Not only will it help them with their procedures in class, but it will help boost their grade. And they can be done over and over and over again until they get a grade perfect score. Hopefully they do. Okay, as with anything, you are going to be introducing the module and on day one going over where things go as far as bloodborne pathogens are concerned, how to clean tables, where to put needles, what goes in the sharps container, what goes in the biohazard waste. This module will be practicing writing prescriptions. There's fillable PDFs for students to use. You'll also be teaching dosages. Some students have some math anxiety with this. Keep that in mind as you are going over dosages. Try to keep it as simple as possible, as not to overwhelm them. You will find that there are plenty of videos embedded in this module for demonstration, as well as practice assignments for math. There are plenty of practice worksheets here that are not graded, and then a dosage calculation assignment on day 3. And then here's our first Simtex simulation test due on day 4. That would be for the intradermal injections that you're going to be starting with first. So I talked about classroom management a bit just a few seconds ago. I suggest that you get all of your equipment up and ready and available way ahead of time. So double check to make sure that you have enough needles, that you have enough syringes, that you have the gloves that you need, enough sharps containers. Look at your McKesson sheets to make sure that you have all the supplies that you need. Order them at least 2 weeks before the module begins, especially your sodium chloride bottles and your Practa powder and your ampules. Those are not ordered from McKesson, though you can find them on the last section of the McKesson supply sheets. If you are unsure, please ask your campus supervision and they'll help you find them. Sometimes they take a little bit longer to come into the campus, so make sure that you are doing this way ahead of time. Don't want to be scrambling later for supplies from another campus. There are 2 pharmacology assignments that are due in this module. The first one has to do with classifications of medication, and then the next one is about medications themselves and information on how to give them, and make sure that you are making yourself familiar with those so that you know how to present those to your students. Once they get working on those will be ongoing in-class assignments. It will give them something to do while you're working with other students practicing injections. Make sure that you are not unpublishing any of the assignments or tests, as those can cause trouble later in the module. So if they are published, please keep them published. Try to keep the days unpublished until you get to that specific day. There's a dosage calculation test, which is on day 8, and the last test for this module is administration medication test. Since you are going to be working with possible biohazardous materials, with needles that are used, please take your time and make sure that your students know the importance of safe needle handling. Make sure that when you're bringing your students up that you are not overwhelmed with a whole bunch of other students watching to get excited. Make sure that you're keeping them in their seats and that you have your eyes on only the students that you need to watch. No student should be using any medication equipment, so no needles, no syringes without your knowledge and your eyes watching. Or if you have a large class, make sure that you're working with your supervision to provide you with a teaching assistant. Students should not have full access to any syringes and needles, which means that they should be handed out only what they need. We have had needles and syringes walk away from the school and are used outside of the classroom without our knowledge, which is not acceptable. So they should always be kept in a locked cabinet without students having full access whenever they want to go and grab some. Okay, so pretty much this is how your module should go. Take time to read your chapter so that you're familiar with the injections that you're going to be giving and following each one of the steps in the procedures in your MA book. Students can follow along with those procedures as well. To be proficient, students must be able to properly follow the steps without you saying a word to them while they're giving the injection. Once they can do that, then you can give them credit for their proficiency. So we will be giving injections in the deltoid, the vastus lateralis, the ventral gluteal, as well as the dorsal gluteal muscles. I know that many places are no longer using the dorsal gluteal muscle, but there are places out there, there are still physicians and practices using this muscle. Students still need to be able to find that muscle and properly follow steps. If you would like, I suggest that you use a very small needle for the dorsal gluteal injection. You can use one of the subcutaneous needles as long as students know that those needles are for subcutaneous use and that you are just practicing for angle and position. That is acceptable. We will be doing insulin subcutaneous injections as well as injections in the arm for subcutaneous injection use. We are not using any other site on the body for subcutaneous injection use. Same will be for the intradermal injections, will only be used in the forearm, nowhere else on the body. That doesn't mean you can't show somebody where the injection goes, it's just students will not be practicing in any other spot than what I have just previously stated. I hope you found this video to be helpful. If you have any questions, please contact your campus supervision, or you can email me. I'll be more than happy to help you with what I can. And with that, have a good rest of your day.